Okay, reported findings for the pinched nerve, the disc with the pinched nerve. This could be in the cervical or the lumbar, it doesn't matter. By the way, there's a couple doctors that use the spine, the little spine model with the little disc coming out. I'm okay with that. I kind of just use this. Now, when I do it, I've just finished my straight leg raising because I've done my neuro, my reflexes sitting down. I've done my muscle testing. And this is a lower back. If you're muscle testing the upper extremities and you find a weak reflex, a weak muscle, you're done. In the lower back, you got to add the straight leg raising reflex. In the cervical, if you want to do some compression, that's fine. But remember, you've already got a weak reflex. You already have a weak muscle. You know what it is. Now you're just going to irritate that nerve by doing a compression test, in my opinion. Okay, so I immediately tell the patient to stand up because I don't want to have them sit. Sitting usually is going to cause that disc patient to be worse. Okay, I'm sitting down and I'll take a piece of paper and I'll put it right on the table. Okay, Mrs. Jones, I'm going to tell you what you got. I'm pretty sure you've got a pinched nerve. Now, I only diagnose a pinched nerve about 3% of the time. The reason I think you got a pinched nerve is you've seen that reflexes was weak on that side and that muscle strength was weak on that right side. That's indicating a pinched nerve. When I raised your leg, okay, it caused a lot of pain at about 30 degrees and you're stretching that nerve root. If that nerve root's inflamed, it's going to cause a lot of pain. What we're going to look for is that straight leg raising to come higher and higher over time. Okay, so you've got a pinched nerve. So here's what we got. You ready? Ready, perfect. And I've got my spine here. So, Mrs. Jones, here's the spine, here's the bones, here's the disc in between, and obviously these are where the nerves come out. So I'm going to cut you through the disc, so I'm looking down at the disc. Here we are. Does that make sense? Yep. Okay, so and I still have my spine. I crank it open. Here's where the spinal cord is, right behind the disc. You've got nerves coming off that spinal cord here. Okay, and then this bone is shaped like a diamond behind it. So you've got bone, bone. Okay, so I've got you cut through the spine and you're facing that way. Does that make sense? And just about all of them will get that. I can't even remember the last time somebody can't get it. Okay, now, the inside of a disc is a jelly-like substance. The outside is hard and cartilaginous. Sometimes this jelly-like substance can start to break through. It can cause a bulge here, hitting this nerve and causing pain. Pinched nerve. Other times, this jelly-like substance can come all the way out, hits the nerve and causes pain. Again, a pinched nerve. I think more than likely you've got one of those. Okay? Any questions? So here's what we're going to want to do. I'm going to go right into my reported findings. Or actually, this is my reported findings. I'm going to go right into my recommendations. Okay, so for this, because this could need surgery, we're going to go aggressive on it. So I'm going to see you 10 times over the next 2 weeks. I'm going to give you one stretch to do, McKinsey's. We're going to ice a lot because remember it's an inflamed nerve. So we're going to do a lot of icing. The other thing is I want you to avoid the sitting position as much as possible. And here's why. So I go to the Punjabi and White study. I tell them this is a study done by 2 Harvard medical doctors. Okay, and I show them the study and they're looking at disc pressure. Okay, so in the lying down position, it's the lowest disc pressure. When you stand, the disc pressure increases. But you can see that disc pressure increases more in the sitting position than standing. When you bend over, standing up, the disc pressure increases. But slouching at the chair is actually worse than bending over. Okay, so sitting has higher disc pressure than standing. So we want to avoid the high disc pressure. They all get it. So they will avoid the sitting position as much as possible. I know you've got to sit some. So when you sit, I go to the other side of the study. We want you to use a lumbar support and we want you to lean back about 10 to 15 degrees. Okay? And even though I don't want you to sit, that's a better way to sit when you're sitting. Okay? Any question? Oh, we're also going to adjust you. So we're going to add manipulation. What the manipulation does is it loosens up the joints right around the disc to allow it to function better so that the inflammation starts to work out also. So we're going to manipulate you 10 times over the next 2 weeks. You're going to be doing one stretch. You're going to be icing 2 to 3 times a day. Okay? And you're going to avoid the sitting position. When you sit, lumbar support 10 to 15 degrees back, but try to avoid that. Okay? Now, can you make that 10 visits over the next 2 weeks? And we got to, because this could be a surgery.
Yes.
What we're going to look for is, remember, that leg was positive. It causes a lot of pain down the leg at 30 degrees. I'm going to look for that leg to start to come up after the 2 weeks. Okay? If it's starting to come up, that's an indication that the inflammation is starting to leave the nerve and will continue to treat. If it doesn't come up, then we're not going to go any further. We're going to refer you either for an MRI or we're going to refer you out for a neurologist.
Okay.
Questions, comments, concerns?
No?
Let's see what we got. Let's go.
Okay.